Hi. Well, it's monsoon time and finally that's arrived after scorching heat. But monsoons come along with a lot of increased chances of acne, skin infections, all kinds, bacterial, viral, fungal. It also leads to more hair fall. So let's learn how we can combat that timely. Regarding hair care, that's the most commonly asked question to me. So we'll first address to that exclusively today here on The Print, where hair care in monsoon especially needs attention, where you're not doing excessive styling, excessive chemicals, lot of blow dries. Avoid too much of heat in your hair, especially during monsoons. If you have to color, start increasing vitamins for a week and vitamins for a week after the color. Very importantly, if you have more than 100 hair fall every day for 3 months, that's what's called chronic telogen effluvium. If you're already facing hair fall in the summers and you're entered with the monsoon season, it's a great idea to do a few blood tests. The blood test I would strongly recommend would be vitamin B12, calcium, vitamin D, TIBC, which tells us the iron content of the body, along with serum ferritin. Besides, of course, the routine random blood sugar and HbA1c, along with thyroid levels, T3, T4, TSH, all the three, which would help us understand if the reason of hair fall is more than just a vitamin deficiency or seasonal. If you're somebody who's going in a public transport to your office and you feel your hair would get wet, it's a great idea that if you can immediately put some clean water. If not, you should keep a spritzer, especially for us ladies, you can keep a spritzer of rose water. If you can't put clean water and it will get further wet for long hair, you can just put some rose water so that the acidic rain or the rain which is having so much of pollution and chemicals is not sitting in your scalp for hours and hours. Of course, very important during monsoons, have a balanced diet, and yes, even if it's water everywhere, you need water inside. Our bodies need 4 to 5 liters of water for adults to function normally. So please stay hydrated and drink a lot of water. If you're facing hair fall, another thing I've learned in my so many years of practice, always keep your head up while you're taking a shower. If you put your head down, gravity aids and causes further hair fall. If you're facing acne, especially in adults or in youth, you should use certain home remedies. Besides, you should definitely use a niacinamide or an azelaic acid serum or a cream for your face, along with some antibacterial face wash. Home remedies like Fuller's Earth and sandalwood works immensely beautifully for reducing acne, but for normal skin only to be used. If you feel you're having bacterial infections, and especially if you're diabetic, take extra care. Do not go for any kind of an elective surgery during monsoons. That should be a lifelong mantra. These elective surgeries should preferably done after monsoons and not done in the season where there is higher risk of bacterial infections. It's very important, particularly for men and boys of all ages who have to wear shoes and socks and go to work. If they are diabetic or if they are prone to infections or they've had infections before, they should start sprinkling some antifungal powder in their feet, in their web spaces. And also it's a great idea to keep an extra shoe at office so that they can actually change their shoes when they reach office, and they don't have to stay in wet shoes for long hours, which can further lead to lots of infections. Nail care is important too during monsoons. Try and keep your nails clean, or put nail colors which are lesser strong, lesser dark, like black and dark brown, because you won't even come to know when you have a fungal infection. Especially if you're diabetic or a man and you pull these nail, the cuticles here, or you bite your nails, be very particular that the cuticles are kept very clean in monsoons, because bacteria and fungus can sit here and even lead to systemic infections and diseases which could be fatal. So here we are at the end of this. Please keep asking us questions so that we come up with interesting topics for you.